the enteric nervous system referring to?
So let's start with the brain, right? The brain is classically what we call the central nervous system. So the central nervous system is the brain and the spinal cord. And then there are a variety of peripheral nervous systems. One of them is the autonomic nervous system. The autonomic nervous system is what controls functions such as heart rate, blood pressure, stress responses, temperature regulation, all the things that you're not supposed to be aware of, but are vital for your health. And then there is the enteric nervous system, which is also a standalone, relatively autonomous nervous system that is contained entirely within the wall of the gut.
Yeah, I think for a lot of people, myself included, you think about the brain and you think about neurotransmitters, but there's actually a huge number, something like an estimated 100 million neurons in the gut. And neurotransmitters are produced in the gut. And two chemicals that come up time and time again in migraine is serotonin, which is very well known, but also GABA. Can you talk about the production of serotonin and GABA in the gut?
Yeah. So, it's estimated that 80 to 90% of the entire body's serotonin originates in the gut. And the serotonin is actually produced by the lining, or most of the serotonin is produced by the lining of the gut. That's interfacing with the food, the microbiota, or anything else that's inside the gut itself. And what serotonin does, at least one of many things it does, it triggers what we call peristalsis, which is an orderly sequence of events that causes the gut to push food down. GABA is a very interesting drug in the gut. It's one of those drugs, unlike serotonin, that has been relatively poorly studied, even though we've known for a long time that the concentrations of GABA in the gut are extremely high. We don't fully understand what GABA does in the gut. There are some clues that it is an important neurotransmitter for motility and secretion. But exactly what goes wrong when GABA is not produced in enough concentrations or produced excessively, we don't fully know.
You mentioned before the microbiota, and if anyone's doing some research about the gut and migraine, the gut microbiome comes up quite quickly in the explanations. Can you discuss what the relationship is between those two and what they are?
So the microbiome is another way to talk about the bacteria in different organs of the body, right? So when it comes to the gut microbiome, we mostly are referring to the trillions of bacteria that live in our colon, which is where they normally reside in greatest abundance, although there are bacteria in the stomach, and to a much smaller extent in the small intestine. Clearly, there are bacteria in the mouth. That's the oral microbiome. There are bacteria on the skin. That's the skin microbiome. So anywhere where bacteria, and actually, if you want to broaden that, it's not just bacteria. It could be viruses, certain kinds of fungi. Anywhere that they live in what we call a commensal relationship, which is a relationship that is of mutual benefit, that's the microbiome. So with respect to gastrointestinal related disorders and the gut-brain axis, we usually talk about the gut microbiome, and typically we are referring to the bacteria in our colon.